I am actually the director of the MCH Leadership Training Program, along with Holly Grayson, who didn't tell you that she was part of the leadership of that, as well as I'm also the director of the MCH Epidemiology Training Grant. We actually have a very long history of MCH in this institution. And in fact, we started back in the late 1940s with Paul Harper when he began the first MCH program. And it was within about 7 or 8 years after he started that program that we actually received the very first training grant in maternal and child health for training public health professionals. We have now had a training program for 56 years in the department, and we also have had an MCH epidemiology training program for doctoral students for the past 10 years, as long as that program has existed. And what that training grant funds has permitted us to do are sort of several things. But first of all, to maintain a presence of MCH in the School of Public Health. And first of all, it did it through funding both faculty and students. And more recently, we've really turned our attention to putting those funds much more into students and student tuition and a variety of activities in which they can engage that teach them the skills of public health. Under the vision of Don Cornley and then supported strongly by Bernie Geyer, doctoral education was developed for maternal and child health, and we actually became the model of how to do doctoral education for MCH in schools of public health. And in fact, today's keynote speaker is actually one of our graduates. And one of the things that we've done more recently under the leadership of Bob Lum is actually to pay more attention now to the development of our Masters of Health Sciences program, which is actually soon to become Masters of, I guess I can say that, of Science in Public Health. And so under his leadership, we've been able to do that. We also have recently, as I suggested, been able to turn our attention as we've partnered with the Women's and Children's Health Policy Center and actually become part of that, to turn our attention to development of skills of our graduates through translation of research into policy and practice, through providing them with opportunities for internships, particularly in Title V agencies, and to really provide them with a variety of different venues in which they can develop their skills. So the training program has been very important to us. It's also helped us to actually reach out to the workforce in maternal and child health. And through Holly's leadership, we've been actually able to develop some very nice distance education materials for leadership. And we're now in the process in this new phase of our training program to actually develop some products that can be used for developing skills, particularly related to critical thinking and analytical thinking through the training funds. So it's been a very important program in our department, and we hope it will continue for another at least 56 years, or at least as long as the Bureau exists.